Shubor naga Khlam Jong San Hima.
Menteri Berdaya Yakatanat Kokot Kakia Nega Janmi Jong Kashi Pauterik Urisau Hajar Ar Ulapan Banaya Jingto Meghalaya Mental Health and Social Care Policy Hagasngi Le Burom Yaka World Mental Health Day. Haba ai jingkran Chekilat Pathai Kubor U James Ula Ong Baka Jingdon Ka Khlam COVID-19 Khandai Kalakta Jor Yaka Jingmut Jingpyrkhat Bar Kalakta Lajan Shibilion Ngut Kibriu Hakapartaihi Barok away. Ula Ong Baka Deiru Kabakong San Ban Kren Halor Ban Pendu No Yaga Jingbu Dak Snew Namarkani Ka Khangla Dikitu Kibriu Kibashakta Bakinwan Shakhamat Ban Pan Jingeram Badi Kiweiru Bakin Kershan Lang.
As we celebrate the World Mental Health Day today, 10th of October, and I take immense pleasure and honor in announcing that the government of Meghalaya, the health department, has completed the exercise of preparing a draft mental health policy, which we are announcing today and which will be put up in the public domain, namely in the website of the Department of Health and Family Welfare and of the Meghalaya NHM. The name of this mental health policy is the Meghalaya Mental Health and Social Care Policy. This policy has been in the making for quite some time. This committee, which was formed to look into drafting this policy, was formed some time back under the chairmanship of our principal secretary, who was tasked to come up with the policy. And accordingly, there have been a number of meetings which have taken place towards the drafting of this policy. Another subcommittee was also formed to go into final details of the policy, which was formed some time back, and this subcommittee was headed by Dr. Kumar, who also is one of the members of the National Mental Health Policy Drafting Committee, and also one of the members of the Tamil Nadu State Mental Health Policy. So she, along with other team members of the subcommittee, including Samvad, were instrumental in providing a lot of work in terms of adolescent and child mental health. We've been able to today, because of the work put in by the subcommittees and by the committee, come up with a mental health policy which is very, very holistic in nature. And I would like to take this opportunity to just go through some of the salient features of this policy, that the stigma surrounding mental health among people. Other salient features is an integrated care system and workforce, which involves bringing together diverse groups of to adopt healing rituals and indigenous medicine alongside contemporary mental health methods, ensuring continuity of care through a larger workforce that is culturally sensitive and responsive to and enabling availability of local and trained workforce. Also, an increase in number of indigenous workforce will help service communities better and ensure continuity of care. We are also looking at the use of sub-centers and our village health councils as platforms for information dissemination and sensitization. We are also looking at focus on multi-sectoral participation from diverse stakeholders and peer advocates. This we feel will help in building trust and focus on personal recovery and valued social roles. There's also this focus on reporting and providing access to the vulnerable groups, and also focus on research and evidence-based practices for impactful plans and policies and inclusive long-term care options. So this is the draft policy which is being made available on the website of the Meghalaya Health Department. And this will be made available for the next 15 days, seeking the views and comments of the public. I would like to take this opportunity to urge the people of our state to go through this draft policy and to give us their suggestions, their views, and their comments, whether they are in agreement or whether they are in disagreement, whatever the case may be. We seek the views and comments of the public because they are the biggest stakeholders in this whole exercise. And I hope that people will go through this draft mental and social care policy to come up with good suggestions which we will be able to incorporate into our policy. Will be, if there is merit found to it, incorporated into the mental health policy and will be then taken up to the cabinet for its approval. So some of the salient features of this mental health policy is that there is a focus on public mental health to promote a holistic well-being approach. This involves the creating awareness, through the existing 460 sub-centers and more than 6,500 plus village health councils, with a focus on promotion of mental health. It entails supporting residents through problem solving, especially in the context of vulnerable groups, working on collaborative care designs, cultural congruence, building a sense of community ownership to tackle the issue of mental health. The emphasis will also be laid on building safe spaces and a first responders team who would offer psychological first aid. Here our focus will be to prevent and address distress and loneliness. Other salient features of this is early identification and care pathways. As part of an integral public mental health approach, ensuring early identification and care pathways through mental health triage scales to address concerns based on need urgency while building effective follow-up systems. This would involve putting systems in place like making services accessible to people's homes through integration of PHCs and CHCs with emergency care and recovery centers. The care teams would be linked to specialists through tele-psychotherapists whenever needed, and bed capacity would also be enhanced. Availability of medication would also be ensured for all. Those critical gaps that are there, gaps wherein we understand that there have been many cases, very very unfortunate, of students having committed suicide, which is so sad. That if they had been able to maybe had somebody to listen to them, a counselor who would be able to identify the signs of suicidal tendencies, then we would have been able to save those children, which is so unfortunate. And we understand the fact that in today's world, students, they live with a lot of stress in their lives. It's not just adults who are going through stress daily, but students undergo a lot of stress. And that's what this policy seeks to achieve, to look at how we can have that support system readily available for them, which will be made available, as we have mentioned. I mentioned that how do we make sure look at the pathways to seeking healthcare. So it's not just for students, but for anybody and everybody who goes through stress and feels that they need to just reach out to somebody and to talk to somebody. So those are the things that we are seeking. So pathways are a very integral part of this mental health policy, and we hope that with this, things will smoothen out and will get more streamlined. But having said that, a government policy is always a living document. It is not a perfect document on its own, So it is a document which will continue to grow, to change, to adapt to circumstances, and this, I believe, is a start. And it was very important that Meghalaya took the initiative and took this start. And I feel that this is going to pave the way for much more better healthcare for people with mental illness who do not come forward, or they don't want further social stigma attached to their loved ones or their children, so they stay away from from seeking medical care towards that. And therefore, the numbers would be much more than what would be available with us, because the data available with us would be of those who have sought medical health care towards any kind of mental health problems that they may be having. So as Principal Secretary was mentioning, the policy document is a roadmap, and a roadmap can only be derived at when you know where you stand. So the research which has gone in, based on which this policy has been drafted, is very comprehensive, as Principal Secretary was mentioning. Situational analysis has been one of the bases is situational analysis, and second is the secondary set of data that we have. So now we know where we stand and where we need to take things forward, and this is the goal that we are setting out for ourselves in terms of mental health. And I think that to admit and to recognize the fact that mental health is a very serious issue in itself is, I think, one of the most positive signs for us as a state. And now that we recognize that, and we have taken steps to formulate a policy to look at what is the roadmap ahead for us, I think this is what is the biggest takeaway from today when we are celebrating World Mental Health Day. I think that it's very unfortunate that incidents took place, but to say that government hospitals don't have the facilities, I think would be not correct. We do have the facilities. Sometimes it's also the timing. So when an accident of trauma, or an accident, or a victim of accident or a trauma, by the time he reaches the hospital, it could be too late to salvage the situation. So there are many factors. But to say that we don't have the necessary infrastructure in place would be, I think, wrong. So it's always situation to situation. I'm very saddened by the fact that this person had to lose his life. But it's always a constant endeavor that looking at certain way that things are moving. We need to keep abreast of the latest technologies, and we have to keep looking at how we keep improving the system. And that's something I think is never ending in terms of how the government and the health department is working. They're always working towards constantly seeing how we improve the system. And her other colleagues, Dr. Sanjeev Jain, Dr. Alok Sarin, Dr. Kishore Kumar, and all the members of Banyan, the members of Team Samvad, who have also been so helpful in helping us draft this policy, and the other members who have been part of this team, like from NIGRINS, from NIMHANS, that is the National Institute of Mental Health and Neurosciences, policy research fellows from the PSRMA Fellowship for Legal and Policy Research, from civil hospitals of Shillong and Tura, from the Lancet Psychiatry Commission on Psychosis from Cornell University, from the Schizophrenia Awareness Association, from the Tata Institute of Social Sciences from Mumbai, the LGB Regional Institute of Mental Health Tezpur, Assam, the NYU Silver School of Social Work, then many others. I would not proper focus to it for an extremely long time, and COVID has come across and shown us that how mental health is becoming such a huge concern, which must be addressed at the earliest. And we are very hopeful and positive that this mental health and social care policy of our state will be able to address many of the issues relating to mental health now and in the future, so that we will be able to take care of those people who have mental health issues. We will be able to, through our concerted efforts, be able to get rid of any kind of stigma that is attached to people having problems with mental health, and hopefully that this will be a game-changing exercise and will give us direction and focus on this extremely important, very important sector of healthcare. Very grateful as a department to the various people who have made immense contribution to this whole exercise. The whole process has been done in a record time, I must say, and which is indicative of the fact that the people who have worked on this policy have worked tirelessly night and day, and they have come up with this beautiful policy which is very, very holistic in nature, and which is why I would like to place on record my thanks to not just my officers.
He has gone through all those studies, and what this committee has also done is situational analysis, report. They have come here, spoken to different stakeholders, including some of the patients, including those caregivers, including NGOs, including the government functionaries, and then they come out with, based on the primary data which is collected through a situational analysis report, but also through the secondary data, which is already we have global burden of diseases report is there, and national NFHS data is there, and there are so many studies have been done. All the reports have been taken into consideration, and that has been based on that this has been. One of the findings is that we need to train more professionals. That's one of the the policy is essentially that what are the issues where we need to focus upon. So now we will work on that. So now we need to get train more in service doctors and psychiatry. Recently, I think our honorable minister, we all went to Tamil Nadu to sign an MOU with the Tamil Nadu government, where they can help us in training our in service doctors, because we don't have that kind of a training facilities in Northeast. So we are actually taking that help. We have one facility in Tejpur. There also we train some of the doctors, but we are going to send more and more people. The kind of a thing is there. Basically, we that exact we don't have the exact data, but if you go by the district mental health program and all, there is a particular number is there. Right? In fact, it is there in the document. If you can see that document.